Hello, everyone. It's Wednesday, January the 13th. I told you the other day on Monday that I felt like we probably didn't have all the reporting in from the weekend when I announced we had 40 deaths. We got 77 deaths that we have received since Monday. I'll read those right now. And I absolutely, want to push you to keep these people in your prayers. I mean, we could easily say, we got 77 deaths, let's go to something else. I mean, should we not acknowledge these people? And absolutely, as long as I'm here, we're going to acknowledge them. Our 1,595th death is an 85-year-old female from Putnam County. Our 1,596th death is a 77-year-old female from Marion County. Our 1,597th death is a 55-year-old male from Cabell County. Our 1,598th death is a 77-year-old female from Lewis County. Our 1,599th death is an 85-year-old male from Wyoming County. Our 1,600th death is a 72-year-old male from Mercer County. Our 1,601st death is a 78-year-old female from Mason County. Our 1,602nd death is a 75-year-old male from Harrison County. Our 1,603rd death is a 57-year-old male from Cabell County. Our 1,604th death is a 72-year-old female from Upshur County. Our 1,605th death is an 83-year-old female from Gilmer County. Our 1,606th death is an 84-year-old female from Boone County. Our 1,607th death is a 96-year-old female from Wood County. Our 1,608th death is a 67-year-old male from Mercer County. Our 1,609th death is a 78-year-old male from Randolph County. Our 1,610th death is a 64-year-old male from Gilmer County. Our 1,611th death is a 58-year-old male from Tyler County. Our 1,612th death is an 84-year-old female from Wayne County. Our 1,613th death is a 72-year-old female from Brooke County. Our 1,614th death is a 95-year-old male from Mason County. Our 1,615th death is a 67-year-old male from Monongahela County. Our 1,616th death is a 75-year-old male from Pleasants County. Our 1,617th death is a 96-year-old female from Jackson County. Our 1,618th death is an 82-year-old female from Jackson County. Our 1,619th death is a 57-year-old female from Mercer County. Our 1,620th death is a 65-year-old female from Jackson County. Our 1,621st death is a 76-year-old female from Jackson County. Our 1,622nd death is a 79-year-old male from Lewis County. Our 1,623rd death is a 92-year-old male from Wood County. Our 1,624th death is an 82-year-old male from Jackson County. Our 1,625th death is a 59-year-old female from Marion County. Our 1,626th death is an 87-year-old male from Monongahela County. Our 1,627th death is a 66-year-old male from Jackson County. Our 1,628th death is a 90-year-old male from Wood County. Our 1,629th death is a 92-year-old male from Kanawha County. Our 1,630th death is a 59-year-old female from Grant County. Our 1,631st death is a 79-year-old male from Monongahela County. Our 1,632nd death is an 85-year-old female from Randolph County. Our 1,633rd death is a 79-year-old male from Jefferson County. Our 1,634th death is a 64-year-old female from Monongahela County. Our 1,635th death is an 81-year-old female from Wood County. Our 1,636th death is a 75-year-old male from Berkeley County. Our 1,637th death is a 70-year-old female from Brooke County. Our 1,638th death is a 77-year-old female from Wood County. Our 1,639th death is a 96-year-old female from Kanawha County. Our 1,640th death is a 69-year-old male from Berkeley County. Our 1,641st death is a 72-year-old female from Pendleton County. Our 1,642nd death is an 87-year-old female from Wood County. Our 1,643rd death is a 60-year-old male from Hancock County. Our 1,644th death is a 54-year-old male from Kanawha County. Our 1,645th death is an 80-year-old male from Raleigh County. Our 1,646th death is a 74-year-old female from Boone County. Our 1,647th death is an 89-year-old male from Cabell County. Our 1,648th death is a 72-year-old female from Logan County. Our 1,649th death is an 89-year-old male from Ohio County. Our 1,650th death is a 78-year-old female from Mason County. Our 1,651st death is a 58-year-old male from Boone County. Our 1,652nd death is a 68-year-old male from Hancock County. Our 1,653rd death is an 81-year-old male from Kanawha County. Our 1,654th death is a 73-year-old male from Pleasants County. Our 1,655th death is a 79-year-old female from Mineral County. Our 1,656th death is a 73-year-old female from Ritchie County. Our 1,657th death is a 77-year-old male from Hancock County. Our 1,658th death is an 82-year-old female from Cabell County. Our 1,659th death is a 74-year-old female from Hardy County. Our 1,660th death is an 86-year-old female from Hampshire County. Our 1,661st death is a 77-year-old male from Pleasants County. Our 1,662nd death is a 68-year-old male from Hancock County. I'm going to back up. Our 1,661st death is a 77-year-old male from Pleasants County. Our 1,662nd death is a 68-year-old male from Hancock County. Our 1,663rd death is a 76-year-old female from Upshur County. Our 1,664th death is a 77-year-old female from Kanawha County. Our 1,665th death is a 45-year-old female from Wayne County. Our 1,666th death is a 93-year-old female from Hancock County. Our 1,667th death is a 73-year-old female from Lewis County. Our 1,668th death is an 83-year-old female from Berkeley County. Our 1,669th death is a 67-year-old male from Kanawha County. Our 1,670th death is a 71-year-old female from Marion County. And our 1,671st death in the state of West Virginia is a 96-year-old male from Summers County. Now, if I stumble along the way, forgive me. You know, I continue to say prayer after prayer, as does Kathy. And first and foremost, that these great people, they are our wisdom. Very seldom do we read somebody incredibly young. You know, today I think we read a female from Wayne County at 45 years of age, which is unbelievably young, but you don't hear 20-year-olds. This disease attacks our elderly. They are our wisdom, and we're losing them. And absolutely, please remember them. Please remember all their friends and their family and all their loved ones, and remember them in prayer. We've had almost 1,200 positive cases in the last 24 hours, and our daily positivity rate is 9.09. Our cumulative percent positive is 5.44. If I heard it correctly, I think our nation's cumulative positive is a little over 9%. We're still trending at half almost of what our nation is trending at. I'm not positive of that, so don't hold me to that, but I think that's correct. Our active cases are right at 28,000, and our recovered cases are just under 75,000. We have 765 people that are hospitalized and 204 on the ventilators. Our RT number, our reproduction number, is at 0.93. I don't know that it's been a whole lot lower than that. I think at one time we had 0.89, but we're the third best in the entire nation. And I just read to you 77 great West Virginians that died. And I remind everybody again about being 65 and older, that if you get a sniffle or a headache or you feel exhausted surely if you lose, your sense of smell or taste, absolutely run to the fire, go get a test. Absolutely get a test. If you're tested positive, the antibodies will save your life. You have got to treat it like a heart attack or a stroke and run to the fire. That's all there is to it. If you have any anxiety or any symptom at all, go get tested. On a vaccine update, West Virginia continues to lead the nation. I think it is an incredible accomplishment, because not only is it an incredible accomplishment for us to lead the nation, but just think about this. Just think about it. How many lives are being saved by us leading the nation? I mean, when it really boils right down to it, we can talk about anything. And I can't get myself away from this. I came to you the other day and Squawk on the Street, had a great piece that we showed you. I told you about what was going on with Fox and Friends and stuff like that. There are things within our state that we need to report. And you can get on me and you can say this and that. And all of our reporters and all of our media do a wonderful job. There are certain spots that we do a not real good job. To tell you the honest truth, I think Phil Kabler, showed his colors when he basically made terrible fun of the people, the custodians, and the people that were working right here at the Capitol, and then back to back turned right around and just ditched our foster care children. I mean, that's what happened. And with all that, the Charleston Gazette, and I've said it over and over, but the Charleston Gazette, how could we possibly not report that West Virginia leads the nation in vaccines? How could we not report that if we're legit? Phil Kabler is a gossip writer. He's not a journalist. The paper has turned into something that's not good. I mean, does that mean all media is bad? Of course not. Of course not. But I'm getting ready to read you more stuff, and I'm thinking, well, why in the world am I reporting it or taking the questions from the media? Because I'm reporting it to the people. But at the end of the day, our media is going to ask me today, and I know what they'll ask me. They'll ask me today, well, what do you think about President Trump in this situation? Or what do you think about, the colors on the map? Should we change the colors on the map? Or what do you think about, the teachers', opinions or whatever? And all that's legit stuff. And I'm willing to answer every single bit of it. I've said it, but I'll say it one more time. It's all legit news, and I'll answer every single bit of it. But you know what? At the end of the day, this nation will go on, and as far as questions about President Trump will be gone in 6 days. As far as what we're doing with the map or the teachers and everything, we'll work through every single bit of that. Our scientific community, our medical community, you'll hear from Clay Marsh today, says grades 8th and under, You're so much safer in that school setting than you could be almost anywhere in life, and we're testing everybody under the sun? Are you really kidding me? Really and truly, the work that was done to get these vaccines in our elderly's arms is absolutely the news. And the reason it is the news is one thing and one thing alone. It's saving lives like we can't imagine. Now that's all there is to it. I am all about just that right now. I am all about trying to save lives. I'm not about the gossip. I'm not about the politics. I am about saving lives, period, right now. Now here I go again. I'm going to report to you just something. If you choose to report it, great. And if you don't, that's fine too with me. I will continue to come on this briefing and tell the people of West Virginia, the people, as I have told over and over, the truth. I will tell you the news as I come on here. Now just think with me just a second. West Virginia received yesterday an additional 34,960 vaccines. Now, I have been in constant contact with our coronavirus czar, our general, all the people and everything. They will tell you when they come on today how we're planning to have not only the vaccines that we had, where we had every single one of them in an arm or a name tagged to it, where they're going to come in at the clinic, and some of the people can't get in until this Saturday, or they may be getting in tomorrow or whatever. But what I'm saying to you is we had every single vaccine in our state committed to a person either in their arm or with a name tagged to it already. And then we got in 34,960 more. And you know what we're going to do? We're going to absolutely, and they'll report in just a second, we're going to put every single last one of them in somebody's arm before the weekend's over. You know what's happening with that? In the last 24 hours, we administered 9,885 vaccines. Now let me just jump forward just 1 second and just tell you just this. And I've got this note somewhere really close by here, so y'all forgive me. But I'll just go from my memory. Since we have embarked on this mission here, I think we have put in arms somewhere close to just under 30,000 vaccines to our elderly. Now somebody tell Jim just one thing. And that 30,000, almost 30,000, I don't know exactly if it's 27,000 or whatever, but it's rising like crazy right as we speak. Now, and that did not count the nursing homes. We offered this vaccine to all residents and staff at the nursing homes and the assisted living as well. Now, tell me what the news is. Tell me what the value of a life is. Tell me what the news really is. Just tell me how many lives we saved by the great work of DHHR and the National Guard and all the health community and everybody. How many lives did we save? A week ago, or a little more than that maybe, those people that were 80 plus, those people really had no hope because they were told they weren't going to get their vaccine until sometime, probably in early April. We got 30,000 of them vaccinated right now, or right there at it. What I am announcing today is just this. We have additional vaccines coming next week. We are continuing to push HHS, the US HHS, and we're pushing them hard. And you know why we're successful with this? Is because, like it or not like it, because Fox, and Squawk Box, and all these people are calling saying, what are you doing in West Virginia? What are you doing in West Virginia? And yesterday, Secretary Azar called and said, I want you to go on and tell all the other governors what you're doing in West Virginia because we're failing all across our country. And I got on with the vice president and I told the governors and everything what West Virginia is doing. What West Virginia, little old West Virginia, that was thought of for hundreds of years, as a place where maybe we were backward or dark or dingy and whatever it may be, the coal fields all over us and everything. Really, at the end of the day, West Virginians are so good, so smart, so innovative. Absolutely, the world is now seeing us in that light. And I think, with all in me, that we should be reporting it and telling it to our people because it will only make more and more and more goodness come to our state. Now, I congratulate all the media. I don't have there's no point in, I can't fathom how our state so-called newspaper in our state continues to report and do what they do. Now, the other thing we're going to do is this. When the general comes on here in just a second, he's going to tell you we are going to now CDC is coming out and saying that they want us to go to, or they want nationwide, they want to drop, somebody now is getting smart too, and they say they want to drop the age to 65 and over and just flood these vaccines out and get them in people's arms. I'm all for flooding the vaccines out and getting them in people's arms. But what we're going to do until next week, this week, right now, right this minute, we're going to drop our age from 80 to 70 because these vaccines that we have, this other 34,900, and the general is going to tell you where you can go and where you can take advantage of this and everything. We're dropping our age right now to 70, and next week, if we continue to push, and God knows we will, nobody's going to push any harder than me, but absolutely we're going to push and push and push, and absolutely as quickly as we know we're going to have that significant amount of vaccines that are going to give us the ability to go to 65, we're going to 65. So we're going to follow the CDC guideline as soon as I know we've got the vaccines. And we're pushing it and we're pushing it and pushing it. So to me, again, I congratulate all those that are out there working it and doing all the great work you're doing and everything. Regardless of how we report it and everything, at the end of the day, we are saving lives, and that to me can't be trumped by any news, just about. This is, and not to think, and I'm not saying that it's not news. It's not news, our teachers' anxiety. It is news. It is news about our map and our color coding. It is news about our sports. It is news about God knows it's news, what happened with our, the invasion of our U.S. Capitol and what's going on with our president. But the bottom line to that is just simply one thing. The president that we have today is going to be gone in 6 days. 6 days. Why in the world are we occupying time with that? And the thing would be say, well, then we don't want people to do that in the future and whatever like that. I am telling you, it is a waste of time in my book. West Virginia, like I said, continues to lead the way. Here's my note on this. We actually have, at this moment right now, we have 75,774 West Virginians that have been vaccinated, but I've been told there's a bunch more that we haven't got reported right in here, and we'll have them today, and that number will fly past 30,000 before the weekend. Okay, we have approximately 63. Well, that's not that. Okay, the free vaccination clinics, are being held in Berkeley, Braxton, Cabell, Greenbrier, Hardy, Harrison, Hancock, Kanawha, Monongahela, Randolph, and Wood counties. There's on our website, there's a lot more information you can come up with and get there. The clinics, many of the clinics still require you to have an appointment and not just walk in, and walk-ins won't be accepted at some of the clinics and everything. As our Operation Save Our Wisdom continues to ramp up, I will encourage all West Virginians that are now over the age of 70, take advantage of this life-saving vaccine, because it truly, truly will save your life. All the vaccine stuff should be on your info line or on our websites here. The one thing that I noticed is just this is on one of these charts right here. We way back when we had 109,440 first round doses, and second round doses we had 16,575. While we've gotten 87.1% of the second round doses in somebody's arms, there's 2,000 roughly. There's roughly 2,000 second round doses that we've still got to get in somebody's arm that had the first round dose. And if you're not showing up, really and truly, you're not making the right decision. And if you're not showing up to get your second round shot, we'll wait through this weekend or when you're scheduled to come. But if you're not going to come, we're going to just move on to somebody else. I tell you again about the antibodies. Like I said, if you get a sniffle or whatever like that, go get tested. If you're positive, we can fix this thing. Again, I thank all the pharmacies. The pharmacies, especially Walgreens and Fruth, for all that they've done and everything with the drive-through testing. All the other testing information should be up on the map. School outbreaks, there's really no point in even talking about that because we're not in school right now for the most part. But we've got 4 active outbreaks and 15 confirmed cases. Again, every medical, and you'll listen to the medical experts. You don't have to listen to me, but everybody in the world just goes overboard about how safe our schools and how good our schools have been. And the other thing is, with the dollars that we have, the additional dollars, how much more of an effort we're going to be making within our schools to keep them super safe. I can't make them perfect. There's no way I can absolutely take away all the risk. But today, in what we're living with today, we've got to continue to move forward. We can't just shutter in. We got to move forward. And with that, there is some level of risk. Our churches, we have 11 outbreaks in only 6 counties now. That's Marion, McDowell, Mingo, Monongahela, Nicholas, and Summers County. That's a whole lot better. Our corrections is down now to 380 active inmate cases and 37 staff. That's better too. I remind you again about wearing your mask, getting your flu shot, giving blood. And now I've got an update here on housing. And this is very, very important and everything, and I should have probably moved this up. I wrote on it all over it to move it up, but I just forgot to do it. But I'm going to read to you a little bit now. Today, I'm excited to announce the creation of a new program that will soon help renters and landlords impacted by COVID-19. Now, if you're renting or you're a landlord, you've got to listen to me right now because this is a really big deal. The Mountaineer Rental Assistance Program, administered by the West Virginia Housing Development Fund, will provide direct financial assistance to renters who have lost their job, had their income reduced, or suffered a significant loss or financial hardship because of the COVID pandemic. Working with our partners at the U.S. Department of Treasury, there's money on the way. There's significant money on the way to achieve just this. I don't know yet specifically how the money on the way even though I do know the number, how the money on the way will absolutely flow completely through this or not. As soon as we know that, we'll tell you a little bit more about that. But this program is not open yet. That's really important, and I will update you as to when it is available. You know, we are waiting for additional guidance from Treasury. We expect that additional guidance on the rental assistance program in the coming days. Funds from the U.S. Treasury are expected to be advanced to the state in late January. So this is not wait forever. We're expecting those funds to be administered to us in late January. Please check with the West Virginia Housing Development Fund's website for more information. I want to thank the West Virginia Housing Development Fund Executive Director, Erica Bogus, and for all the great help she's doing, and all that should be up there. And it's really great news to people that are really having a tough time in regard to their rent and everything, and that's good stuff. Last couple of things really quick. We've sent out now $264,478,000 to our cities and our counties. I know it was an unbelievable lifesaver to our cities and counties, and we increased that allocation. We started at 200, and then we increased it to 215 to 225 to 250, and we ended up at 265. But we're now concluding that program for right now. You know, on with us today we have Homeland Security, our Homeland Security Advisor, Tom Kirk, and he's joining us today. He's going to give us an update on security preparations for the legislative session and the inauguration. If he could come on now, please.
Thank you, Governor. At this time, we're not aware of any credible threats in our region or to any of the governmental employees' buildings or any of our state legislators. And it's important that I state region, because we not only watch this, we not only receive information from people within the state, organizations from within the state, but surrounding states and actually all over the nation and its territories. We work with State Homeland Security Fusion Center, the State Police Intelligence Exchange, U.S. Department of Homeland Security, Secret Service, National Guard, Homeland Security, FBI, on and on and on. So we receive a lot of information. We have meetings, briefings, telephone calls daily, sometimes hourly, depending on what's happening. We receive this information, we analyze it, then we brief the governor's office, the Chief of Staff, Brian Abraham, daily, or as the situation predicts. We also give, obviously, information to Secretary Jeff Sandy. And right now, to say that we have no credible threats in our region doesn't mean that we're not remaining vigilant. In fact, just the opposite. We're trying to do, like the governor says, we're trying to keep the people of the state and the property of the state as safe and secure as we can. So again, Governor and the rest of the state, this time we're not aware of any credible threats in our region, and we continue to watch this and continue to brief the governor and his staff.
Thank you, sir. And I know you're on top of it, and you'll stay on top of it. And we want a wonderful session. We need to watch and protect our legislatures, and we want a good, solid inauguration. You know, from the standpoint of the inauguration, we're going to have, you know, we're going to continue on and do it. We're going to do it in the back of the Capitol, and you know, we'll just do it in a lot smaller and a lot different ways than we've done it in the past and everything. And we'll abide by the guidelines, and we'll hopefully be able to celebrate a very peaceful inauguration. But I want to add one more thing really quickly, and it's just this, that I'm really proud of our teachers and our service personnel as how they've turned out to get their vaccine. The percentage, I don't know exactly what it is, but it's really close to 90% or 85% of the people, you know, are taking us up on getting the vaccine. It'll save their lives, and it absolutely will protect them and their families, and that's great stuff and everything. But I think that we're back at it tomorrow and Friday, and I think that'll finish it up. and so I encourage, everyone, and these are people 50 and over, that if you haven't had the vaccine, be sure and try to get it, because I think it's really good, and I'm really proud of you for doing what you've been doing as far as getting out and really getting that vaccine. The other thing I would just say is just this: to the teachers that are under 50, we surely haven't forgot you, and we're going to pivot right back. All we got to do is just get the vaccines, and really, I can't tell you enough about how much the national reporting about how West Virginia's successes have been has helped us get and achieve more and more possibilities of vaccines coming to West Virginia. So with all that being said, all I can say is we're going to continue to push to get more, because absolutely the more we get, the more lives we're going to save. So anyway, thank you a bunch.
All right, thanks, Governor. Let's now go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. As the governor pointed out, we have significant movement this week on both finishing the vaccinations for our over 50 teachers. 9,700 will receive vaccines across 55 counties Thursday and Friday. In addition to that, as the governor pointed out, 14 regional locations to work vaccines for our 80 plus, now 70 plus population. We continue to work the rest of those activities. A lot of additional work going on to continue to prepare for, as the governor pointed out, changing that age criteria to 65. We continue to press on the testing side, as well as Secretary Crouch and Dr. Amjad can allude to later, but we have continue to be one of the top in the nation related to testing, and the top in the nation. I just looked at the most updated tracker, highest in the nation, 5.98 per 100, moving those vaccines out, and the governor continues to press. As I talk with him regularly about this, keep your foot on the gas, but keep it at the appropriate pace, and we continue to move forward, and we'll continue to press that forward. We have doses leaving that left the hub yesterday and left the hubs today to those 14 regional sites and to those 55 county locations. We'll continue to keep you updated as more information comes available. Thank you.
All right, thank you, General. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning, and I want to make my comments really follow in very close order with what the governor and General Hoyer has said. In West Virginia, we have done, I think, amazingly well, given where we had the potential to go. Kaiser Family Foundation, as you remember, rated us as the most vulnerable state at the beginning of the pandemic, and our projection from the University of Washington's data projection center for COVID deaths was about 1,500 to 1,600 by November 1st. And we're really proud of the great work of all of our teams, and certainly the governor's leadership. We owe a debt of gratitude to the National Guard, to DHHR and others, and folks that are leading the Joint Interagency Task Force. But I think that this is a more foundational issue that we should really start to think about. There is a lot of people that are very scared right now and worried about COVID, many different beliefs out there. But the key for us is we've been able to stay together. We've been able to operate as a team, as a unit. And I think that at the leadership level, that's also been a critical success factor. And so as we look at where we're going, it's really important that we are committed to getting vaccine to every West Virginian's arm. We know that even as of today, our average age of somebody dying of COVID-19 is 77 years old. We know that we have about about 240,000 West Virginians who are over 70 years old, about 80,000 West Virginians over 80 years old, and about 130,000 or so West Virginians between 65 and 70 years old. We know that West Virginians over 70 years old account for 77.5% of the people dying. So absolutely, we are committed to not only help vaccinate people in our other prioritized areas like teachers and healthcare workers, certainly nursing home residents, which has been so important, which account for about half of our deaths, as we've said before, but really push those vaccines to our absolute most vulnerable people. And I think that for a lot of the folks who are service personnel, whether it's healthcare service or National Guard service or educational service, that we want to make sure that those environments are really safe. But we've learned a lot about the COVID pandemic. We've learned a lot about the virus, some of which we have to continue to monitor very closely as people have read about these different genetic variants, these mutants that are coming up, and we're making sure as a field that the vaccines and the antibodies and all that will work okay against these mutant viruses. And so far it appears that they will, but we're continuing as a field to do research on that. But I think it's really important, and I want to re-emphasize the issue about, in the hospital setting, in the clinic setting, in the classroom setting, that we know that spread is very, very rare in those settings. And in fact, as we look at our evidence, our own epidemiology evidence, we may see outbreaks in hospitals and we may see outbreaks in schools. But the difference between outbreaks, which is people that test positive that are in these places, and the transmission within these places, we see very little transmission in hospitals and clinics and in schools. And in fact, I posted an article that was done from Duke University that was based on the year's experience with North Carolina school systems. And they investigated 773 outbreaks in North Carolina schools. And they found 0 cases of any transmission from a student to a teacher in the classroom. And I think it really just underscores the safety of these environments when people wear masks and distance. And of course, people are still worried, and I understand that, and I empathize. But all of the parent organizations, the American Association of Pediatrics and others, really believes that kids need to be in class and school. And when we start to look at recommendations from guidance group like Harvard and others, they very clearly also recognize that when we first started, we thought community transmission was really the driver of school spread, of in-school transmission. But in fact, that's not what we find. We find that schools and hospital settings and clinic settings, with everybody wearing the appropriate personal protective equipment and making those safeguards, are actually safer than people in their own communities. And as we heard, a lot of the spread now is happening in communities from people who are being exposed to each other. And there's been a revalidation of the idea that most spread is coming from people that are asymptomatic or pre-symptomatic. So as the governor said, if you get a sniffle, if you get a cold, go get tested, because today we are worried about that. And we do have very effective strategies to intervene, whether it's monoclonal antibodies or whether it's other approaches that could really, really help. And it also helps us prevent that spread, and that's really important as well. So as we look at choosing to be vaccinated, it is really important, as the governor pointed out, that if you've gotten your first vaccine, please get your second. That's the way that these vaccines are effective, and that's what the clinical trials have shown, 95% effective. And if you're due to get your first vaccine, please choose to get vaccinated. It's going to take a while for us to get the level of immunity we need to get in West Virginia as people are getting vaccinated. But I am so proud of the fact that we are pushing vaccines out faster than any other state. But I'm not proud only because we're doing so well as a state. I'm really proud, and I'll just reinforce what the governor said, because every vaccine means that we are potentially saving a life, saving a child, saving a family from having their parents die, their grandparents die, and helping West Virginia be a place where we can realize the type of life and the goodness that we demonstrate to each other on a daily basis to the rest of the world. And right now, our country and our world needs role models, and West Virginia has been that. But it's really important that during this next phase of the pandemic, that you pay a lot of attention, choose to get your vaccine, please, but also make sure you wear a mask and do those other smart mitigation efforts. The next month is a really critical time for us. So thank you.
All right, thank you, Dr. Marsh. Dr. Ina Amjad, our State Health Officer, and Bill Crouch, Secretary of the West Virginia DHHR, are both joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I got a call yesterday from someone who wanted to know if there is any vaccine prioritization for folks who are disabled, either mentally or physically, or does it all come down to age? Do any of those conditions give people priority? Thank you.
General, you got to answer this, please, sir.
Yes, sir, Governor. So, Charles, right now the primary focus is on age. We continue to staff within the Interagency Task Force how to also work on those populations that are vulnerable, as you pointed out, that particular population. So we continue to work those activities as vaccines become available, and we will be presenting more information on that in the near future.
You just say, General, if you could tell them about your mobile unit that you have, that you're moving towards too, please.
Yes, sir, Governor. So one of the things that we are working with a couple of the federally qualified health clinics on being able to roll out mobile support activities with those clinics to get affected population, Charles, like you referenced, as well as homebound, and we'll be working with senior services and VOAD as we go forward and vaccines become available to roll those out where appropriate.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, I have a question for General Hoyer. General, what do we do when we get unequal or additional, I should say, doses of vaccine? If a clinic is able, or if a healthcare facility is able to get, say, 5 doses out of a vial instead of 4, and we've got these extra doses. We're hearing some anecdotal reports, people calling in, that if there are extra doses, that some have gone out to people making calls to maybe members of the organization they're working for, or just friends in the community they know that can get there, because they don't want them to go to waste and they don't want them to expire. So is there a plan in place to try to more formally organize that situation and maybe create waiting lists or ready to call lists of people who are in the age groups and the targeted groups that you guys are looking at to see if we can get that vaccine to them, instead of just randomly calling up friends and family or acquaintances or business associates and getting the vaccine out to those people? Thank you.
General, go.
Yes, Kenny, to your point, there are both with Moderna and Pfizer vaccine, there are cases where we get additional doses out of vials. There also have been certain circumstances where the vials have had less than the allotted amount. But to your specific point, the local health departments, as well as the clinics that we are working with, maintain lists of those individuals within the age groups who need the vaccine. So we strongly encourage and work with those entities to get those vaccines out to those individuals, or in the case of a hospital where hospitals may get additional doses related to their employees that we're working to vaccinate, we ask them to vaccinate additional hospital workers so that we can continue to stretch these doses out as best as possible.
Got to come back to me just a second. And Kenny, the only other thing I would say is just this. First and foremost, you're dead right. That we don't want this to go, just to, friends and family or whatever. We need these doses going in the arms of the 80 and the 70 now year old plus, and without question. And they should have their call list and everything. And I'm sure they follow that and everything. But when we get to crunch time, I think with one of the vaccines, we got a 6-hour shelf life. They got to move. And if we get into crunch time, the last thing on earth that I want to have happen is have people that are throwing away this life-saving drug that can really save a life. And so, when that happens and everything, we got to get it in somebody's arm, and maybe from time to time we'll fall down and not get it in the 80 plus or the 70 plus, but getting it in an arm is awfully important versus throwing it away.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Governor, I have one message that came last evening about unemployment, saying that people have been on the phone a long time and then been hung up on because of being on the phone that long, I guess. One example given was somebody was on the phone for 7 hours and had a bad experience. Are you getting similar reports to that? And what are you doing about it?
Paul, I just checked with our people that are in the room here, and there's just 3 or 4 in there, and they're saying, no, we're not getting those calls and everything, but I'll follow up on it and everything. That's the last thing on the planet that we want is somebody waiting 7 hours. I don't want them waiting 7 minutes. And if we go back and we're fair, we just go back to when the first rollout of all this, where we had all kinds of stuff shut down and everything and all kinds of people unemployed. And we were in the first rollout, we were trying to keep up, and Workforce West Virginia was trying to keep up, and they weren't. And then what we did is we moved in with the Guard, and the General, did a terrific job, and they moved in, and all of a sudden we had many, many, many more hands and eyes and everybody working. But when that happened, we still didn't get it done. And then at that point in time, I said to the General, triple the number of guardsmen, triple the people that you've got, that you've got on the job to make this go away and get these checks out and get this to happening to our people that are unemployed. And then that didn't work either. And then I said, triple the triple. And then we got it. So at the end of the day, whatever we got to do, we're going to try with all in us. And if we've got people out there that are hurting and they can't get through to us and everything, we're just going to do what we got to do. We're not going to just say, oh, well, we got we're really trying hard and all that kind of stuff. We're not going to do that. We're going to get it done. So I've not heard that, Paul, but we'll check into it.
All right, thank you, Paul. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. And Governor, if you may indulge me and let me just make a brief statement and then get to my question. I just want to point out that on Monday night, the broadcast we did here, the story I did included a good 10 to 15 second clip of you on CNBC, which went out to all of our stations to let them know that this is indeed getting nationwide attention. And as I think our signal regionally runs from east of Columbus, Ohio, all the way to the Atlantic Ocean, includes all of Washington, D.C. and most of 6 states, probably an audience of 8 to 10 million people. And then later that evening, you were a guest on News Nation, which is on WGN America, a nationwide newscast with probably a market penetration over 200 million homes. It's a network nationwide broadcast. And the reason I know that is they called on me to brief the anchors with what to ask you and what to talk about in terms of what West Virginia has done right. And so we're doing our part to get the word out. We have a professional and ethical obligation to do that as broadcasters, and a moral obligation as human beings to get the best information out there, not only locally, but nationwide. And just rest assured, we are doing it. And I think most of the people in the media are trying to act just as responsibly. So I just wanted to make that factual statement. And now my question. I got a lot of calls again yesterday from people who are getting threatened with their utilities being cut off. They're behind on their water and electric bills. I called over to Charlotte Lane at the Public Service Commission, and what they were telling me over there is call the governor's office, because what we want to know is, in the latest CARES Act, was there more money provided by Congress and the president to help people catch up who are behind on their utility bills? Because a lot of people are being threatened with shut-off notices, and it was 20 degrees overnight. We're going to have people freeze to death if they get their water or electricity cut off. And so what's being done to address that in terms of new funding to help folks?
Mark, I think I can answer this and answer it real quickly. First of all, thank you so much. I know you do a great job. I appreciate you beyond belief. I know we can do better in certain areas of our media across our state. I'm not talking to everybody. You should know that and everything. People should know what I'm trying to do and say here, and I'm really, really proud of what we're doing and accomplishing in West Virginia, and it truly will help us in every way to get more vaccines. That's all I'm wanting. All in the world I'm wanting. I don't need a red feather. All in the world I want to do is absolutely get more and more goodness for West Virginia. But anyway, I thank you for your comments there. And the other thing, in regard to what you just spoke about, we shoved a bunch of CARES money at that before because gosh almighty, are you kidding me? You're in the dead of the winter. We're blessed that it's not 2 degrees outside right now. I remember the blizzard was Jay Rockefeller was the governor and everything. And I remember that very well and everything. And I remember the 10 days when we had actual temperatures significantly below zero. And I know just how bad it can get in January, especially in January. But with all that being said, there is money. We haven't seen the stuff yet and everything, but there is money on the way. And just what I just described just a second ago about the renters, about the rent being backlogged and everything, it is in that also there is some aid for utility and everything. And so from the standpoint of our people being able to have dollars to come that can help towards that question you just asked about, I believe it's on the way. We have not seen it yet and everything, but I believe that is in the package and on the way.
All right, thank you, Mark. Next to Brendan Tierney with WSAZ.
Hello, Brendan Tierney with WSAZ News Channel 3 here. My question's for the governor. On Monday, you mentioned that today you would be officially signing your executive order to reopen schools next week and kind of laying out the plan for that. I was hoping you could explain to us what exactly you hope to have in that plan and explain why so much effort's being put into a statewide plan when most of the emphasis is being put on local control at the county level. And we're seeing multiple counties, including Kanawha most recently this morning, voting to stay in remote education through at least early February. Thank you.
Well, Brendan, let me tell you this. I think the state board is meeting right now. I've said many, many times from the standpoint, I think they govern whether or not our schools are open or not open. As far as going full remote or going blended, I think in Kanawha County, they said that they're going to go remote unless the state board, comes out with a different ruling. And then at that point in time, then they're going to have to reassess and maybe go blended and everything. I think what is going to come out of the state board is just this, that we're going to have the option of going full-time to school if counties decide to do that, or we're going to have the option, to go blended until all of our teachers are, that are in 50 and older and our service personnel 50 and over have received their second shot. And once they've received their second shot, then they're supposed to go full-time. And that is under the, 8th grade and under. Because how many times we're going to have to hear it? I mean, how many times do we have to hear it that our kids need to be in school? How many times do we have to hear all the tragedy that's going on by our kids not being in school? And how many times do we have to hear how unbelievably safe that it is to be in school with kids that are not transmitters of this? And we can't be 100% in anything in life, can we? But our scientific community, our medical community tells us just how safe we are. And all of our education community tells us these horror stories that a third of our kids, are failing. When they tell us horror stories about kids that are being abused and all kinds of different needs for our special needs kids and whatever it may be. I mean, for crying out loud, we know how badly we need to be in school. So with all that being said, we want it to be super safe, and everything. And from the standpoint of sports and all that, I want you to know again that if we're not in school, we can't play. Education is the first priority. The parents should reach out, to the local boards and let their voices be heard as well. I know how tough it is, on daycare and all that kind of stuff. We know how safe it is to go back to school, 8th grade and under. We are still working on the modification, if there's going to be a modification in regard to the map, as far as expanding the orange, to a higher level, to where we won't go into red until we reach a higher level. But right now, I think the ruling is going to be that we're going to say on that is we're going to just stay right where we're at. The 25 is we're going to stay right where we're at. And if you go into red, we don't go to school 9 through 12, but we go remote. But I really believe that we're working through all these things the very best we can, and we'll be reporting back to you. But as far as everything, Brendan, that you asked, from 8th grade down, I believe we're going to be in school on the 19th, and I think we're going to have our schools open statewide on the 19th.
All right, thank you, Brendan. Next to David Beard with the Dominion Post.
Hi, I have a question plus a clarification, further clarification on a prior answer. And I'll start with the clarification first. That was on Charles Young's question on people with disabilities. And I just wanted to ask if General Hoyer's answer applied to people with developmental disabilities, particularly those in group homes and people with Down syndrome. And then my question comes to me from some seniors who contacted me. They're either have had or about to have their first vaccine injection. And they look at the vaccine dashboard and they can't tell from the numbers that are posted on there if you have adequate supply for them to get their second shot. And I wonder if someone could explain that for them. Thanks.
General, go, sir.
Yes, sir. So, David, we are working to identify how to best serve individuals across all disabilities. So, folks can be assured that we're working all of those as vaccines become available. Related to the second dose, if you received a first dose in the Operation Warp Speed system, a second dose is assigned to you in the system called VAM. So individuals should not worry about the second dose availability. Those are assigned in the larger system. Thank you.
All right, thank you, David. Next to Joe Severino with the Charleston Gazette-Mail.
Hi, everyone. I'm going to open this up to everybody. Matthew Watts, a pastor on Charleston's west side, is asking the state to move Black West Virginians who are older than 60 into the next priority for vaccines because of the drastic racial health disparities that exist in the state and the fact that the few Black communities in West Virginia have overall far lower life expectancies and higher poverty rates than the rest of the state. The state designated Black communities as a vulnerable population, like the same as nursing homes at the beginning of this pandemic. So how will these communities be treated with vaccine priority like the other vulnerable populations? Thank you.
Joe, let me take the beginning of this and everything. Let me just say this, Matthew is a real friend and a champion, in my opinion. And what he's done, in the Black community is amazing. And I'll never forget this. This moment I'll never forget. He's welcome with me at any time, anywhere. But I can remember, I was actually running for office the first go round. And he was with a group, we were with a group of, I think, pastors at the time. And there was a pastor that led us in prayer. And we were getting ready to leave. And as he was praying, Matthew reached out and put his hand on me, on my shoulder. And literally, what a good man. What a good man. And you're right, there's surely a disproportion, that people from our Black community and everything have been suffering, with a disproportion here as far as the numbers, that are skewed, to where we need to be more attentive and everything and help in more ways towards our black community and everything. But maybe someone, on here could add to that, but maybe I'll try, Secretary Crouch, if you know more about this than I, please.
We're very concerned about getting to that population. It's a population that hasn't tested well. We try to get to communities, African American communities and minority communities. It's very difficult to have mass testing and get to all of those locations. We've asked Reverend Patterson, who we contracted with to do testing for the African American population. We've asked him to submit a proposal to assist in immunization of the African American population. He submitted that day before yesterday, and we're reviewing that right now. And we hope to fund that quickly so that we can really target getting folks out in that community on a more mobile basis. Our mass immunization clinics are not reaching everyone, and it's the same with the IDD population and developmentally disabled who are in waiver homes and group homes. We're looking at another way to get to those individuals, and we will do that. And as General Hoyer said, we will prioritize those individuals. Thank you.
Jordan, come back to me just one second. Joe, let me say this. I love your question, and I promise you, I'll put some extra oomph into this and work on this a little harder too, to where we can, make sure we're really trying to move that ball as hard down the field as we possibly can. But thanks for the question. I love the question.
Great, thanks, Joe. Last question today from June Leffler with West Virginia Public Broadcasting. June, I think your mic may be muted.
So,
yeah, we got you now.
hi, okay. Thank you so much. So, so we know that the state is very interested in meeting the CDC's recommendation to lower the age to get vaccines out to those people. The CDC is also interested in supplying more vaccines to states that have a higher percent of elderly people and a higher percent of those with underlying conditions. I would just like to know from the panel how they think those CDC recommendations are going to impact not just how they distribute, but the supply they're going to potentially be able to get.
And Jordan, her name?
June.
June, okay. June, the lady that worked is my dad's right-hand person, her name was June, and it's a very dear name in our house because she was a really wonderful lady. But June, let me say this, and then I'm gonna pass it off to our medical community primarily and everything. But here's the whole key. You touched kind of on it and everything, but one of the gigantic success stories and keys is just this: the CDC is saying over and over and over, we want to send more vaccines to the people that are demonstrating that they're getting it in people's arms. That's our entire strategy. That's the entire goal. Our goal is not to be the star of the game show. Our goal is to get it in more people's arms so that we'll get more vaccines. So what you're saying is exactly what we're doing. And I'm very, very hopeful that we'll start that increase of vaccines. And I'm very, very hopeful that that's going to start next Monday. But anyway, General Hoyer, go, please. Or maybe, I'm sorry, Dr. Marsh, please.
Sure. Thank you, Governor. Thank you, June. So you have really hit the nail on the head. We believe, as the governor said, and as I said earlier, that a vaccine in an arm may equal a life saved. And so when we look at national data, we know that people 65 to 75 years old have a 90 times risk of dying and a 5 times risk of hospitalization versus 18 to 29 years old people. Folks 75 to 85 have a 220 times risk of dying and a 8 times risk of hospitalization versus 18 to 29-year-olds. And people over 85 have a 630 times risk of dying and a 13 times risk of hospitalization. And as we've said, 77.5% of our deaths in West Virginia are from people over 70 years old, and half of our deaths are from people in nursing homes. So trying to reach these prioritized groups, both to be able to get more vaccine, as you suggested with the new outlay of the plans from HHS and CDC, but also because we want to reach this population because it is our most vulnerable. And as we get more vaccines in, of course, we want to continue to move those ages down to include these critical populations that we've talked about earlier here, whether it's the African American community, whether it's people with disabilities, people living in congregate settings with disabilities particularly. But as we go forward, that really becomes possible as we have more vaccines. And the only other thing I would just point out is that we have laid out a, I think, fairly clear plan as far as prioritization. And we've said that we're not going to be sequential, we're going to be overlapping. So at the same time, we're really trying to push vaccines toward the people that are the most vulnerable, our oldest, and others that we've mentioned. We're also very committed to continue to finish our vaccination of our high priority groups in phase 1. So all of these groups should get more vaccines. And ultimately, the more vaccines we get, the more people we can vaccinate. So thank you.
All right, thank you, June. Governor, I'll turn it back to you.
Okay, well, again, you know, I've got just 2 or 3 points that I wrote down while we were going through this. One, Dr. Marsh touched on earlier, and that is he said we stayed together. Now, you know, look, there's times that I'm blunt, and there's times that I'm you know, really passionate in my, you know, in my voice and my feelings. You know, hopefully I don't get that way, you know, and just to get that way. You know, I've been a coach forever, and I really believe that when things get tough, I mean, things get really tough, somebody's got to have a cool head, and somebody's got to not be a cheerleader. Somebody's got to be calm and be under control. That's the way I've coached forever. When the game's on the line, I'm going to be the one that's standing there thinking and not just be the cheerleader. Now, with all that being said, what we've done in West Virginia that is the key so much is we have stayed together. You've trusted me, and I have led you to the very best of all my abilities. It's not going to be perfect. Only the good Lord was perfect. But we've done great, West Virginia, and we got to stay together because we have absolutely shown the nation and the world just how good we really are. And that is invaluable to us as we go forward. Now, the other thing is just this, that by your questions to the media, I'm sorry, by the media's questions and your questions and concerns and everything that you voice to the media, you know, we can see there is one thing for sure. There's a lot of people that are really motivated and a lot of people that, to be perfectly honest, are desperate to really be able to get their vaccine. We got people calling from everywhere, and they want to know, when am I going to have the chance to get my vaccine? Well, you know, that's good in a lot of ways, and it's tough and it's sad in a lot of ways too. But the goodness is just this. Stay fired up to get that vaccine because it is absolutely going to save your life. Now, with all that, I would say continue to push us. Continue to push us. Now we're 70 plus that we're going to be putting shots in the arms. We're going to run out of vaccines. We're going to run out of vaccines until next Monday. And then we're going to run out again until maybe the next Monday. And we're going to absolutely keep pushing them and pushing them and pushing them in people's arms, and they're not going to sit on a shelf. They're not going to sit on a shelf. We're not going to study something. We're going to absolutely put them in people's arms. So I would ask you again, push us, people, and everything, and we will do the very best that we can possibly do. Now, at the same time that you push us, please be considerate and appreciative of us, because we are doing the very best that we can possibly do with what we've got to do. If we have 1,000 vaccines and we have 1,500 there, we can't give out but 1,000. But be appreciative of the effort that we're trying to do, because it's not Easter. It's not April. It's not time, to go on an egg hunt or whatever it may be. It's January. And January, where our seniors and our people that are 80 plus, 70 plus, and will quickly move to 65 and right on down, absolutely, it's not April. It's January. And we're getting it done right here in West Virginia. It's not April for the teachers. It's not April for the service personnel. It's January, and we're getting it done. So all I ask is be appreciative of all those that are out there on the front lines, and they're doing everything they possibly can to help you. And because we're going to continue to push here, but push us too. I love it, West Virginia. You're so, so, so good at what you do. And we're going to try with all in us to absolutely save as many lives as we can save each and every day. Thank you a bunch. God bless all of you.